While the strategy remains the same, the current epidemiological evidence and clinical advice shows that we must make the tiers tougher than they were before to protect the NHS through the winter and avert another national lockdown. So we've looked at each of the tiers afresh and strengthened them, as the Prime Minister set out on Monday. In Tier 1, if you can work from home, you should do so. In Tier 2, alcohol may only be served in hospitality settings as part of a substantial meal. And in Tier 3, indoor entertainment, hotels and other accommodation will have to close, along with all forms of hospitality except for delivery and takeaway. Mr. Speaker, I know that people want certainty about the rules they need to follow in their area. These decisions are not easy, but they are necessary. We've listened to local experts and been guided by the best public health advice, including from the Joint Biosecurity Centre. We set out the criteria in the COVID-19 winter plan, and we published the data on which the decisions are made. As the winter plan sets out, the 5 indicators are the case rate in all age groups, in particular cases amongst the over 60s, the rate at which cases are rising or falling, the positivity rate, and the pressures on the local NHS. When setting the boundaries for these tiers, we've looked not just at geographical areas, but the human geographies which influence how the virus spreads, like travel patterns and the epidemiological situation in neighbouring areas. While all 3 tiers are less stringent than the national lockdown that we're all living in now, to keep people safe and to keep the gains that are being made, more areas than before will be in the top 2 tiers. This is necessary to protect our NHS and keep the virus under control. Turning to the tiers specifically, the lowest case rates are in Cornwall, the Isle of Wight and the Isles of Scilly, which will go into Tier 1. In all 3 areas, they've had very low case rates throughout, and I want to thank residents for being so vigilant during the whole pandemic. I know that many other areas would want to be in Tier 1. I understand that. My own constituency of West Suffolk has the lowest case rate for over 60s in the whole country, and I want to thank Matthew Hicks and John Griffiths, the leaders of Suffolk and West Suffolk councils, and their teams for this achievement. But despite this, and despite the fact Suffolk overall has the lowest case rate outside of Cornwall and the Isle of Wight, our judgment, looking at all of the indicators and based on the public health advice, is that Suffolk needs to be in Tier 2 to get the virus further under control. Now, I hope that Suffolk and so many other parts of the country can get to Tier 1 soon, and the more people stick to the rules, the quicker that will happen. We must make the right judgments guided by the science. The majority of England will be in Tier 2, but in a significant number of areas, I'm afraid, they need to be in Tier 3 to bring case rates down. Now, I know how tough this is, both for areas that have been in restrictions for a long time, like Leicester and Greater Manchester, and also for areas where cases have risen sharply recently, like Bristol, the West Midlands and Kent. The full allocations have been published this morning and laid as a written ministerial statement just before this statement began. I understand the impact that these measures will have, but they are necessary given the scale of the threat that we face. We'll review the measures in a fortnight and keep them regularly under review after that.